Welcome again to Ultra Medical Solutions Limited. In our earlier video, we talked about the closed and the figure control suction catheters. Now, this is a figure control suction catheter. On this edge, it's connected to a conventional suction machine. And then your control comes over here. Now, look at it this way. When the caregiver is doing suction on the patient, actually the caregiver is in direct contact with the catheter itself. Assume, maybe by chance, the gloves on the hands of the caregiver, maybe they are torn. It means you have exposed your staff to infections. As opposed to the closed suction catheter, it looks like this. The catheter itself is covered by a sleeve. So even if I don't have gloves, the sleeve itself gives an extra protection to the caregiver. Now, I just want to discuss about the content or what it is with this closed suction catheter. We have two different types. We have this, and also we have this one. Sorry. Let me take or this content. We have these two. You will appreciate both of them. They've got the sleeves with them. So the catheter itself, it is already covered. Now, when you are doing the suctioning, the only difference comes at the point of your connection to the catheter mount. Look at this. For you to have the catheter out of this connector, there is what we call a Parker valve. See, it is the catheter that usually pushes the Parker valve for it to open, for you to introduce the catheter into the ETT. Maybe I should take the ETT and then connect it over here, that way. Such that now the catheter will get into the endotracheal tube, into the patient. Then when you remove the catheter, it will definitely get out through the Parker valve and it will open automatically. The reservation that we have found with this is with the number of you moving the catheter into the patient, at times the Parker valve becomes loose. Now, because of product improvement, we thought about having such an ETT. Look at this. We are having the catheter itself is here, right? Now we take our ETT and we introduce it over here, that way. Now, for you to have the catheter into the ETT, you have to manually open this connector over here for the catheter to get in all the way to the patient. And when you are done, once you withdraw the catheter, or when you are done with the suctioning, you remove it and then you close manually such that it can't get in. At this point, you are sure that at every point, your patient is on a closed loop. Now, the other advantage you find with this catheter is that when maybe you want to clean it, because it's being used on a patient for 7 days, you've got a point for purging over here. What you do, you get water into a syringe, then you connect over here, and then you purge. And then it will clean up your catheter, and then it will get into your suctioning device, be it a suction machine or maybe you're using wall vacuum. Now, the other aspect you also find with this catheter, maybe there are inhalation drugs that you have to deliver to the patient through the ETT. You've got the provision over here. So you just take the drug with your syringe, or maybe from a syringe pump, or either from an infusion pump. It's connected over there, and then you are able to infuse into the patient. Now, in any case that you have to provide nebulization, you are able to connect your DPs over here, and then you are also able to do nebulization to your patient. Now, maybe I'll just do an illustration on how all this connection is done to a patient. We'd assume you have the breathing circuit, and mind you, this is an anesthesia breathing circuit. Reason being, it doesn't have a water trap. When we talk about a ventilator breathing circuit, either disposable or usable, it must have the water trap, like this. This is what I'm talking about. Because of the long-term ventilation need of a patient, you need to have the water trap. Maybe at some time, the breathing circuit becomes watery. Now, it have to connect over here instead of getting back to the machine. Now, that's not where we are. Now, assume you have your breathing circuit connected to the patient. So you have it over there. That's an extendable breathing circuit. Now, from here, you need to connect to your HME. Also remember, depending on the patient size, HMEs have different sizes. Like this is a neonate stroke infant HME filter. This one is a pediatric HME filter. And this one over here is adult HME filter. So depending on the size of the patient that you have, use different sizes of HME to ensure that you give optimum mechanical ventilation to your patient, and also for the safety of the patient. Because depending on the size, you're also creating what we call densities. So for neonates, when you are using this, remember you have done some parameters of FiO2 delivery to the patient, either through pressure control or volume control. So it's always essential for you to use the light HME filter. Now, let's use a pediatric HME filter. We'll connect it at that point. It's the first device for you to connect after the breathing circuit. And the use of HMEF, when you're using it on a ventilation, it's when we are doing what we call passive humidification. You are relying on this pouch over here to trap that humid that is getting from the patient, to make the air humid in the second inspiration phase of your patient. Then from here, you connect the catheter mount that way. Now we are done with the normal suction or with the normal ventilation circuits. Now at this point, when you are using a conventional suction catheter, we have the ETT connected over here. Now the ETT is in the patient. Now when you are using a conventional or figure control suction catheter, you actually have to remove the patient from the circuit. You take your catheter, insert the catheter into the ETT. Actually, you do your suctioning, then withdraw the catheter, throw away, and then you take the patient back to the breathing circuit. Remember, when you have already opened the patient from the closed suction system, you are recruiting the lungs. You are not helping the patient. Also, you are in full contact with the suction catheter, were it not for the use of gloves. Now, at this point, now here comes the closed system suction catheter. We'll go step by step. Over here, this connector is the one that provides the connection of the suction catheter into the breathing circuit at this point. So how does it usually go? You shall remove the catheter mount, then it is usually connected over there, and then you take your ATT, it is connected over there. Now you have a closed system. At no one point you have the patient open in an open circuit. Now, maybe you want to do suction, right? How do you go about it? With the use of this suction catheter with a Parker valve, see, you just push in the catheter. It will get through the ETT all the way. You'll do your suctioning. Remember, at this point, you have connected this to a suctioning apparatus, be it a suction machine or maybe from a vacuum line. So you do your suctioning, and then you shall withdraw your catheter after you are done with the ventilation. Remember, at the same time, we talked about this pot over here that helps you in purging or cleaning the catheter. Remember, we also say this is meant to be used for 7 days. Ultra Medway Solutions Limited, we usually say that it's an exceptional hub for quality products. In any case you wish us to do a CME on this and any other product, we are always open to do this. Thank you.